We have the privilege of broadcasting from our brand new facility here at the Douglas A. Dillon Center. You may also hear it called the DAD Center from time to time, and we're located here on Highway 90. After looking at our data and information from our surveys from last year, we have been able to come up with some topics that will cover areas that you as parents have interest in. So tonight we will be doing our new format, and our new format is that we are going strictly virtual. So we have our live streaming tonight. You will also be able to call this recording up on demand so that you can review it or look at it again at your convenience. And this year we're not having the live in studio audience, just because last year that was an area that wasn't nearly as attended as it was you parents joining us virtually. So again, these will be recorded. We will also have some segments recorded for you from our program facilitators, where you will be able to get additional chunks of information on the topics that we are discussing. So tonight, please remember that you will be able to ask any questions of our guests by typing in the comment sections, and those will come up, and we'll make sure that we address those questions with our guests. Tonight, we are honored to have Dr. John Hodges and Dr. Teresa Mahaffey joining us today. And we're going to be talking about different mental health concerns and issues that we are seeing in the schools, and mainly focusing around anxiety and depression. So welcome. We're so very happy to have you guys tonight.
Thank you very much.
So just to get ourselves started, we kind of wanted to, maybe you can introduce yourself and talk to us a little bit about your specialties, and then give our parents, I think one of the areas that our parents had concerns about was signs and symptoms of anxiety and or depression. I think we were talking earlier before we went live and kind of had the discussion that anxiety seems to be the more difficult topic to be able to look at and diagnose as far as parents, what to look for and how that may manifest itself in our students.
Yeah.
So, welcome.
Glad to be here. I'm John Hodges. I'm a licensed psychologist and see a lot of kids with behavior problems, emotional problems. I see a lot of anxiety, and that's a particular interest that I see, because sometimes it can look a lot like ADD, attention deficit disorder. If a kid's anxious, then they're going to appear distracted. And then after a while, if a youngster is anxious and they get tired of really battling it, then oftentimes we see depression go hand in hand with it. And the primary symptoms that I look for with anxiety in particular is a tendency to avoid. They want to avoid whatever it is that is a concern. If it's school, they don't want to go to school. If it's social situations, they want to avoid social situations. And so you see kids who avoid, sometimes you can see physical complaints. All of a sudden, if your kid's been healthy and you're getting a lot of physical complaints, headaches, stomach aches, especially the stomach. I see a lot of kids with stomach distress, and that goes with anxiety. Those are probably the primary things that I see as initial symptoms.
With those, I know that as a school setting, we hear and see from the teachers that our students sometimes do behavioral type of issues in the school, and I think that concerns the teacher, because they don't know where that line is. That how do I know if a child in my classroom is having some type of anxiety, or is this a attention-seeking type of behavior. Is there any way for the teachers to be able to look out for those symptoms or those signs, to be able to tell the difference, so that when they're talking with the families, that maybe the two can come together and seek help for the students?
Yeah. Typically, if it's attention seeking, then it will be modified by behavior management. If you implement some sort of behavior management program, the child will respond to that if it's attention seeking, if it's behavioral. If it's true anxiety, you can threaten them with the worst possible consequence in the world, and you cannot get them to do it. And sometimes anxiety comes out in the form of anger. Kids that are explosive. And what happens is, when you're anxious, you feel the need to defend yourself. And when we feel the need to defend ourselves, then we go into fight or flight, which is a very irrational, there's just no logical thinking, no rational conversation. And so if the kid's in the fight mode, then you're going to see aggressive behavior. But it's not just I want my way, it's really anxiety-based, and the response and treatment is to be very different.
How would, and this is for both of you, how would parents know when would be an appropriate time to bring their child in for an evaluation? You know, is there anything that would stick out to them? I know a lot of times when we're talking with our parents, they're just not sure what may be age appropriate. Sometimes they worry about the teacher expectation. So how would the parents in the school know? You know, as a school, we can recommend, you know, that they seek medical advice, because we're not doctors, and we don't make diagnosis on our students. But at the same time, we want our students to be able to succeed and to help the families. So are there any particular recommendations for the parents to know, hey, this is going beyond what's expected, and may be time to seek out help?
I look for impairment. All of us have anxiety. All of us get sad. But when it starts to interfere with your ability to meet your responsibilities, if it interferes with the ability to maintain performance at school that is typical of that student, maintain relationships, be able to, if it interferes with their life and their ability to function, then it's definitely time to seek help.
I wanted to just add to that, that's exactly true, but also you have to have parents who are astute enough to notice the changes, or I have a lot of patients who come from homes that are less than desirable, and many times these kids just slip through the cracks and end up with a really poor report card, but there's no one at home that really cares that much about it. So you have to, it's a very complicated situation with many layers on top of that one child.
So if a child has true anxiety and the school is seeing it, would the parents also be seeing it at home? Because, you know, a lot of times as a school setting, we will hear that from parents, well, we don't see that at home. And part of what we try to explain to them, though, is in the school setting, it's a much more structured setting than what it is at home, and the expectation is different than being at home, coming home, and being able to have some free time there. But wouldn't they see, maybe in their interactions with their parents or their siblings, or possibly even the friends in the neighborhood, would they be seeing similar type of characteristics in those environments?
More than likely, but I think there are times where they may not see it, because the degree of social interaction, kids can stay at home and not socialize, where at school they're around 20 kids in their classroom at least, and so they're forced into social situations, and that may trigger the anxiety that they can avoid at home. The other thing that sometimes happens is we think we train our children, but our children train us.
I have to agree with that.
And so an anxious kid can end up engaging the parents in their anxious rituals. And the parent's not even aware that they're doing it.
Mhm.
And so if the parents are engaging in the rituals that reduces the anxiety, then they may not see it.
That's very true. Our children do shape us a lot
They
of
do.
times. And sometimes we don't even know they're doing it.
Absolutely.
Well, okay, so when we get to that point and a parent is seeking out help, what could be expected when they go to the physician for that first appointment? What would be, just an expectation for them as to what would happen, what the course of action would be?
Typically, my response is I will see, most of the time, I will see the child with the parents. And just take the history. What are the concerns? And part of the reason seeing everybody is so that everybody hears the same things. I want the child to know what we're concerned about and what the parents are concerned about. And so I see everybody, we take the history, and then usually after that I'll see the child alone to determine what's their perspective of the issues and do an assessment of what I think is going on. For anxiety, I'm sort of targeting it because I think parents recognize and look for depression probably more than anxiety. But with treatment of anxiety, there's some key terms that you want to listen for. And that's terms like graduated exposure. For treatment of anxiety, you have to confront whatever it is you're afraid of. If that is not part of the treatment, then there is a high probability of relapse. And so it's really important that parents listen for those types of terms for the treatment of anxiety. It's important, I believe, in children, elementary, probably I would even say middle school, that the parents be involved in the treatment. There is a behavioral component and behavior management component even when there are mental health issues. For example, with anxious kids, the parents are going to need to encourage, reinforce a behavior management program to get the child to try certain things that create anxiety for them so they don't avoid it.
That makes a lot of sense, and that was going to actually be one of my questions, was how involved are the parents in the process of treatment, because I would assume that that would be a very important component.
For me, it is. Now, everybody has their own approach to treatment, but I probably spend 40 to 60% of the time with the parents. Again, elementary. Now, when you get into high school, it gets a little bit different. It begins to change.
I can imagine. Have you, either one of you, have you seen an increase over the last several years of students coming into your practices with anxiety concerns?
Yes, I've seen a huge increase actually.
And not only an increase in numbers, but I'm seeing an increase in intensity of symptoms. For years, I would have patients who reported they were nauseous during periods of anxiety. Now I have kids who are actually throwing up. I mean, it's not just nauseousness; they are throwing up, and so the intensity of the symptoms seem to have increased.
I've seen a lot of kids too, especially middle schoolers and high schoolers with panic disorder, where they actually become incapacitated and they have no idea how to get out of the classroom. So that, we have to, I usually send them to get cognitive behavioral therapy, and then these are the kids that I usually start on meds.
So I would assume then that it would be important to link that home-school connection with us, so that not only are the parents aware of it and working, but that the teachers could be aware of it and possibly work together with the families on what that expectation should be at school.
Absolutely, and if we could just take a specific disorder, school refusal, where kids all of a sudden don't want to go to school. we've identified 4 factors associated with why kids don't go to school. Social issues, not doing well at school, and the whole idea of staying home, playing video games, secondary game, and the 4th is the fear of having an anxiety attack. Overwhelming majority of them are the 4th category. Very few kids refuse to go to school for the first 3 reasons. So it's that 4th reason, that fear of anxiety, and anxiety is really fear of fear. I'm afraid I'm going to have an attack. And it is very powerful, and as we were talking about earlier, you can threaten a child, you can reward a child with the greatest thing, and it will not overcome fear.
I know we've had a few cases, and they may be pretty extreme, of students that became so physically ill at school that they were incapacitated.
Right.
And I know sometimes that looks like it just, you know, you think that couldn't be that severe, that it was just the anxiety from it, but in reality, it turns out that it has, and we've had to be really pretty creative on how we deliver our instruction to them, because some of them have had to go on hospital homebound until it could get under control.
And with the graduated exposure approach, that's where the parents, the therapist, and the school, and the child all working together is so important. So in the beginning, my recommendation to parents, if you have a child who's refusing to go to school, is you go sit in the parking lot if you don't even get them into school. And then you get them to the front door. Then you get them inside the door. And they go to a safe place for a while. And we gradually keep increasing. And so the school really needs to be a part of that treatment process. And my experience is once the school understands this is the problem, they're very cooperative in working with us on these programs.
And from the district level, we have seen that, where we've got the student, we've actually sent a bus to a child's home just for him to get used to the bus.
Yeah.
Okay, then we made it to getting on the bus, not leaving the yard, and then going around the neighborhood and kind of slowly building it back up to where, you know, then it was in the parking lot, and then the child got off the bus, didn't make it in, but got off the bus, but we were eventually able to work it to a point where that child, according to them, felt safe at that point, that they felt like they could make it, plus they kind of felt like the school was then aware, and the teachers or the school staff wasn't working against them. They were working with them in that situation.
And medications can be beneficial, Dr. Kathy referenced that earlier. And it's important to have kids evaluated. You know, parents don't like to start their kids on medications, but sometimes that's the most effective tool to utilize with all these other things we're doing.
Right.
Let me ask you this, and this is just something that I personally, from working with students for so many years, I've seen a little bit of a shift when it comes to, one, language development and social interaction. Have you seen the social interaction decreasing with the gaming world increasing? And I don't know whether it's something that we can actually link to that, but it's been something that I think we've seen in the school setting is sometimes even at the kindergarten level, they're not coming in with that language development to the degree that they used to come in. And so then for us, it makes it a little bit more difficult to really determine for students that struggle, is that due to a lack of exposure, or is it due because the child really has an academic deficit, where they may have a processing problem or something where we really need to get involved in that avenue with it. So was just curious to see if you've seen any of that.
Yeah, my take on it is that those kids who are reluctant to engage in life, school, study, whatever, gaming is a great hideaway.
Mhm.
And so they can hide away, whereas used to kids didn't have that hideaway and would eventually get out and interact more. But now, a kid can isolate and be perfectly happy.
Yeah, that's a different thought. You know, maybe for some kids it's the opposite, that their anxiety is relieved through that, where we may have seen it before manifest in a different way.
Yeah,
Right.
and I do think the lack of stimulation as well.
Yeah.
I mean, I think that's a part of it as well.
So, yeah, I was just gonna say that not only is it gaming, it's also texting and social media. Because some of the older kids that I see, will actually be on their phone while I'm trying to examine them. And so will their parents. So I've run into this many times where I actually have to tell them to put their phones down so that I can do a well check. So, I mean, it's, some of the stuff I encounter is fairly extreme, so, and it's on a daily basis. So, yeah, the whole social media thing is out of control.
Well, you know, that brings up another situation which the schools have seen an increase in. I don't know whether, you know, it would be something that we could put our hands on and being able to say that data shows that it's anxiety or depression in students, but with, or maybe the exposure to social media, but we're seeing more kids that their issues are manifesting in more behavioral type of concerns. Some of that to the point of where we as a school district has to do what's called a threat assessment. Because either they make comments, or quite typically what we're finding now is they do it through social media, where they will make threats on social media towards a student at school, or a group of students, or the school as a whole.
Mhm.
Have you had or seen an increase in students that show that type of behavior concerns?
Yeah, my own personal belief is there's just a disrespect for human life. I mean, when you look at suicide, aggression, just all the statistics, that there's not a respect for human life, and so it's much easier just to make these threats, and whether you're serious or not, I can just say it, and it doesn't mean anything.
Mhm.
Or it does mean something. And the problem is, it's very difficult to know the difference between the two. I mean, in terms of threat assessment, the best predictors we have are past behavior. Well, those past behaviors never change. And so it's very, very difficult to do a good threat assessment. But yeah, I'm seeing an increase but not just in kids. We see this in humans, I mean, adults as well. That if I get mad at you on the interstate, then I'll scream, try to run you off the road, shoot you, whatever.
Yeah.
So we're not just seeing it. I mean, the kids are having role models for some of this as well, which is part of the problem. But you know, you're talking about the behavioral issues. For example, depression. We have a kid who's fallen asleep in class and looks depressed and so forth and so on. What if this kid is up 2, 3 in the morning on his phone and then going to school? How's he going to look? So is it depression, or is it on the phone too much?
Yeah.
And so there are behavioral issues, and I really encourage parents to take the phones at night. The data is 60 to 70% of teenagers are on their phone past 12 p.m. And so, wonder why kids are falling asleep in class.
Yeah.
I make my kids go to bed at 9.
But if they got the phone in there after you've gone, are they still in bed?
Guess I'd have to hide it under the mattress.
There you go.
All right, with that, we're going to take parents just a quick commercial break. And please remember, if you have questions, go ahead and type those in, and we'll be happy to address those.
Florida Diagnostic and Learning Resource System, or FIDLERS, is excited to announce this 5-part webinar series for parents and guardians to explore the world of exceptional student education. You may attend one or all 5 of the webinars offered, and you can register for these webinars at this website provided. If you need more information, feel free to contact us at 850-469-5423 or 888-445-9662. The webinars will be delivered via Adobe Connect, and each webinar will have 2 times that they are offered on the specific date of the webinars. The webinars are offered during November 5th, November 7th, November 9th, November 13th, and November 15th. FIDLERS, along with Emerald Coast Associate Center, enjoy sponsoring these webinars for you. We hope to see you in the webinar series.
So welcome back. Well, we will continue our conversations. And talking about how our parents can get help and they come in and seeking treatment. What are some things that the school district can do to assist you in either making a diagnosis or being able to provide the child with help? Are there things that the school district can help provide to you to be able to benefit the family?
Yeah, so if I have a patient who parents suspect he may have ADHD or ADD, I do always give them the Vanderbilt forms for the parents to complete and the teacher. And it's always helpful to get a little write-up from the teacher as well. I don't necessarily ask for an IQ test unless I think there is a problem there, and that could explain a mismatch of where the child is in the class and why he's not doing well. But usually it's the Vanderbilt forms and then a write-up by the teacher and then an extensive interview with the parents.
And for our parents that may not have been through the process before, what is a Vanderbilt?
So a Vanderbilt is a series of questions that target certain behaviors that we see in ADHD, ADD. You can also tease out some of the learning problems, anxiety, behavior problems that's on the back side of the front page.
So I know one of the things that we talk to parents about, I would assume that to be able to make an accurate diagnosis, that it would be very beneficial for both home and school to make sure that they really stop and think when they fill those forms out and make sure that they answer them as honestly as possible.
Right.
Is what they can think, because I know as a parent, parents may not always want to be forthcoming with maybe how intense the behavior is, because that's their child, and they have that emotional connection to the child. And so I know as a parent, sometimes it may be a little bit more difficult to relinquish some of that information so that they can actually help you in the medical field be able to give the best diagnosis for them. Is there any other suggestions that you would have that either parents can do at home or that the schools can do to help make sure that we get the students diagnosed, and then once they're diagnosed, how the school system as a whole can assist?
When you're filling out the forms as a parent, I encourage you not to include the kid in the process. We used to give the kids a self-report form, but they're so unreliable that it's a waste of time, and so we no longer do that. And so some parents will think that the kid knows better themselves than their observations, which is not correct at all. So we just want the parents' observations, not the child's input, to get those things. And it is hard sometimes to accept that your child has a problem of some kind, so that can be challenging.
Additionally, from the medical perspective, particularly the medication use, the teacher's observations are extremely important because, believe it or not, there are parents who actually want their kids on these medications. So if I see that there's a discrepancy between, you know, a big discrepancy, then I'm not going to prescribe a medication. If the child is doing well in school, just leave well enough alone, you know.
So that brings up, you know, another area with the medication. When would be an appropriate time to prescribe medication for a child? Because I know we do hear that a lot at meetings, that sometimes parents are hesitant for the child to get on medication. And then maybe once, if you do put a child on medication, what are some things that parents in school would need to look out for to make sure that the medication is appropriate or the right dosage, or maybe does parents need to go back?
Right. So when I started a child on a medication, I always go over the side effects, the most likely side effects, as well as what to call me for immediately once the medication is started. And then I always see the parents and the child back in a month, and then every 3 months. So there's a constant follow-up where I can get input from the teachers or a therapist or, you know, and the parents. But I always tell them to watch for sleep problems, decreased appetite, which always happens, or if it's triggered a tic disorder, because sometimes that can happen as well too. So if you notice a new tic, a new movement, that's something that I need to know about. Or if they're really irritable and aggressive in the afternoon when the medication is wearing off.
I was gonna say, those are actually probably what I hear the most of what parents are fearful
Yeah.
of, is one, the appetite, and
Right.
two, the aggression.
Yeah.
They're afraid that their child will get more aggressive on the medication.
Right.
So those are, but are there's medications possibly that, could you have to maybe try a couple medications
Yes.
before finding the right fit for the child?
Right. So I have a lot of patients who have actually been on a few medications, and now there are so many on the market that, and some of them do very well for some kids and not well for others at all. So I have actually started doing a genetic test to see what medications they metabolize best. And that way I can target the meds to their genetics. And that's worked out really well for me.
That's really good.
You know, a lot of times, you know, I will be talking with parents who have not seen or their physician has referred them to me for an evaluation. And so they will be very reluctant to use medication. And one of the questions that I ask is, okay, you're concerned about the side effects of using the medication. What are the side effects of not using the medication?
That's a good question.
And the data shows that for kids who need the medication, that for every 6 years of school, they're going to lose 1 academic year. So they're going to get further and further behind in school. And there's some evidence now that kids who need the medication and don't get the medication are actually more susceptible to substance abuse. They end up self-medicating.
And I think I've read a couple of studies about that, about kids that have gone through and have not been medicated. The articles that I read were talking about the frustration level of the students when they have gone for multiple years without it, and how not only do they become anxious then, but they also it starts affecting their self-esteem because they don't feel like they can accomplish anything. They're not successful in school, they can't focus, and how it just affects not only the anxiety, but it really has an overall effect on the child as a whole.
Oh yeah. And it's interesting because I think the drug of choice for that scenario is marijuana. So from my vast experience with that, but anyway, no, it really is. And then it's interesting too, because when I talk to the parents, I always ask, who has ADD or ADHD in the family? And invariably, there's just a multitude of people. Some medicated, some not. So then I ask, well, what is a person who's not medicated doing? Well, he's had about 5 jobs in the last 10 years. you know,
Mhm.
things like, so it is genetic and you can see the effects of treatment and non-treatment.
And the outcome for non-treatment is very bleak. And people don't
Mhm.
take ADHD very seriously, but there's higher incidence of arrest, higher
Mhm.
incidence of traffic accidents, multiple marriages, multiple
Oh, yeah.
jobs. And the outcome for untreated ADHD is a very, very bleak picture.
Right.
I've heard, and I don't know whether you've seen any studies on this, but also the effect of students as they become older being incarcerated
Mhm.
for making the poor choices. And so that would, then you start looking at that affecting their entire lifespan,
Oh, yeah.
with it.
Yeah.
And so,
I encourage parents to get it evaluated because I think there's a little bit of a nonchalant approach to, oh, he's just got ADHD.
Mhm.
We even make jokes about it and
Yeah.
so forth. But it really does have the potential for very serious outcomes.
Right.
well, I know we see that also as far as the hereditary part of it with our students who may have dyslexia, learning
Mhm.
disabilities. When you really get down and you look at, there's other family members that have the same
Oh, yeah.
type of concerns and same type of issues. And so it does run in families, and that's, some questions that we've been asking to try to be able to gather that type of information to be able to help not only the student, but the family unit,
Yeah.
as
Yeah.
a whole. Well, we do have one question. Ashley, it is a comment that has come from a viewer, and it says that it would be harder to find a better human than Dr. Mahaffey. What a gift to our area, from pediatric care to the transitional programs she created. There might be a clue here. It says, P.S. Patrick is a noble steed. So,
Oh,
so
God.
that may be a hint for
That
you
is
as
a
to who
definite
it
clue.
came from.
Thank you.
All right, we are down to just the last couple of minutes for this evening. So with that, I'd like to personally thank you both for coming, and see first if you have any closing comments that you have for our parents.
If there are any doubts about whether your child needs care, seek it. Get an evaluation done, and if you overreacted, then the therapist will say, no, this is just normal development, and these are the things you can do for it, and not necessarily need ongoing therapy or medication or treatment. But if there's a doubt, seek services.
Yeah. And I would say too, pay attention to your kids. Watch what they're doing, watch what they're watching. Love your kids and let them know that.
I think those are very wise words coming from us tonight. So we appreciate both of you coming, and I'm sure that our parents also feel the same way. Like I said, we have made sure that we're doing the live version so that we can reach as many parents as possible. And I know sometimes it's easier for our parents to hear things when they're sitting in the comfort of their home and being able to process it,
Yeah.
especially when it comes, when it deals with their children, because their children have an emotional connection, and we all understand that. Also would like to remind our parents that tonight's broadcast will be available on our website a little bit later, so that you can watch it at your leisure and when you have the opportunity. I would also like to give a special thanks to Ms. Stacy Price, our guidance counselor from Dixon Primary, for being proactive in assisting us in making sure that we get as much information about mental health to our parents and connections. So she's here in the studio audience. I couldn't get her to come live, but maybe the next time we'll get her up here. Maybe it was because it's a rainy night. Maybe the hairdo's not as great as what it needs to be. But thank you for attending tonight's live Blended Cafe. Our next cafe will be on January 28th. And our topic will be Surfing the Wave to Success by Assisting Our Struggling Readers. That is a very hot topic right now. We will have our struggling readers, and then later on in the school year, we will home in on dyslexia, since that is a very hot topic that's not only in Santa Rosa County, but it is nationwide. And so we will talk with you about that in the upcoming months. Again, if you have any questions or concerns regarding tonight's programming, please complete the form or the contact information, and we will have someone from our district office get back in contact with you to get your questions answered. So thank you, parents, and we look forward to seeing you January 28th. Have a good evening.
The Florida Diagnostic and Learning Resource System, or FIDLERS, is excited to announce this 5-part webinar series for parents and guardians to explore the world of exceptional student education. You may attend one or all 5 of the webinars offered, and you can register for these webinars at this website provided. If you need more information, feel free to contact us at 850-469-5423 or 888-445-9662. The webinars will be delivered via Adobe Connect, and each webinar will have 2 times that they are offered on the specific date of the webinars. The webinars are offered during November 5th, November 7th, November 9th, November 13th, and November 15th. FIDLERS, along with Emerald Coast Associate Center, enjoy sponsoring these webinars for you. We hope to see you in the webinar series.